Today, an oral extended-release ketamine tablet in late-stage trials for treatment-resistant depression. Ketamine works fast, but every current option requires supervised administration. KET01 is being designed to change that. KET01 is a prolonged-release oral ketamine tablet developed by Ketamine, a joint venture between HMNC Brain Health and Develco Pharma. Normal ketamine reaches peak plasma in minutes. KET01 is engineered to peak over 6 to 7 hours, with higher levels of the norketamine and hydroxynorketamine metabolites thought to drive the antidepressant effect. As of June 2026, roughly 180 patients have received the drug. 2 Phase 2 trials frame the picture. The first, in 27 patients, found that 240 milligrams daily for 14 days produced rapid antidepressant efficacy versus 160 milligrams or placebo. The second, KET02, found KET01 kept dissociation scores flat over 24 hours, while intranasal esketamine spiked at 40 minutes. The signal is encouraging. 27 patients is small, and most of the program is still in late Phase 2. 4 open questions, drawn from Medscape News Europe. First, Lowe and Hans Stewart in Oslo. If you blunt the dissociative experience, do you also blunt the long-term therapeutic meaning? He points to oceanic boundlessness, a sense of awe that may not show up on a rating scale. Second, Jolie and Verrat in the Netherlands. Flexible titration has worked best in her ketamine trials, and a fixed prolonged-release tablet may be the wrong shape. Third, Mikkel Tiger at Karolinska. A take-home tablet opens the door to tolerance escalation, abuse, cognitive impairment, and bladder damage. Fourth, Maximilian Dobler at HMNC counters that the tablet cannot be ground for nasal use, and extraction is impractical. All 4 are open. None is settled. A few things KET01 is not. Not yet approved by the FDA or the EMA, not in Phase 3. The at-home use case is hypothetical, and the data are early. 2 small Phase 2 trials and a 12-patient open-label pilot in Sweden that began recruiting in April 2026. For comparison, the IV racemic ketamine literature draws on more than 1,100 patients. KET01 is not there yet. The reason this candidate matters is the population. Treatment-resistant depression affects an estimated 20 to 30% of MDD patients in the EU and is associated with substantially elevated mortality, suicide risk, and accidental overdose. Today, every ketamine-based option requires clinical supervision. A take-at-home oral tablet would expand access for patients who cannot reach a clinic weekly, who live far from a treatment center, or whose maintenance has been broken by logistics. The promise is real. The evidence to deliver on it is not yet. Bottom line, KET01 is a take-at-home oral ketamine tablet in late-stage Phase 2 trials, designed as an add-on to standard antidepressants for treatment-resistant depression. The early efficacy and dissociation data are encouraging, but sample sizes are small and 4 open questions about the experience, the dosing shape, the home use safety, and the abuse-deterrent claim are unresolved. A promising mechanism, very early data, real questions still open. Questions or episode ideas? Drop them below and subscribe for more psychopharmacology breakdowns. Educational purposes only, not a substitute for clinical judgment.